Looking for a bariatric surgeon? In fact, if you're thinking about bariatric surgery, one of the most important decisions you'll make is not just which operation to have, it's who you trust to do it. Because you're not just choosing a procedure, you're choosing the person who's going to perform it. And I'm going to say something very plainly. Don't choose a bariatric surgeon based only on the first name that pops up on Google, one dramatic before and after photo, or one glowing Facebook review. Those things may be helpful, but they're just not enough. Hi, I'm Grace. I'm a physician assistant who has worked with bariatric patients for 20 years. In this video, I'm going to walk you through how I would research a bariatric surgeon if I were helping a friend or family member. We'll talk about licensing and disciplinary history, to accreditation reviews, Facebook groups, and the questions you should ask before trusting someone with your surgery. And I want to be very clear from the beginning. None of these things can guarantee a perfect surgical outcome. Even excellent surgeons can have complications, but these steps can help you avoid choosing blindly. And this is important because bariatric surgery is not just a one-day operation. It's a whole process. There's the pre-op workup, the procedure selection, the surgery itself, recovery, then of course follow-up, and there's the possibility of having complications or issues later on. So you're not just looking for someone who can technically perform an operation. You're looking for a surgeon and a program that can help guide you through the whole bariatric journey. Part 1, start with the basics and verify the surgeon. Verify that the surgeon is licensed and whether there are any obvious medical board actions. One place to start is docinfo.org, which is run through the Federation of State Medical Boards. On DocInfo, you can search a physician and look for information like licensure and whether there have been actions reported by state medical boards. This is not the only place to check, but it's a good starting point. Next, I would also check the surgeon through the state medical board where they practice. Here, I'm just going to show you an example from the Texas State Medical Board. Each state's website looks a little different, but most state medical boards have some type of physician license lookup. You're usually looking for things like, is a license active? Are there disciplinary actions? Are there restrictions? Are there repeated concerns that would make you pause? And I want to be fair here. Anyone can make a complaint against a physician to a medical board, and it must be investigated regardless of its merit. So don't automatically panic over one item. Part 2, check board certification. For bariatric surgeons in the United States, many are board certified in general surgery, often through the American Board of Surgery. Now here I'm going to get on the American Board of Surgery's website and the check a certification page. Board certification does not automatically mean someone is the right surgeon for you, but it does tell you they have met a defined standard of training, education, and examination in their specialty. So at this point, you might be thinking, okay, I've checked their license and they're board certified. I'm done. Not yet, because some of the biggest differences between bariatric programs aren't visible on any licensing website. Part 3, look for a bariatric-specific involvement. One place patients can find this is the ASMBS Find a Provider tool. ASMBS stands for the American Society for Metabolic and Bariatric Surgery. Now here's the Find a Provider page. This directory can help you find providers who are also ASMBS members. Now, important clarification, being listed in ASMBS does not guarantee a good result, and not being listed does not automatically mean a surgeon is bad, but membership can be one clue that the surgeon is more deeply involved in the bariatric surgery community. Now, this next step is one that many patients have never even heard of, but if I were helping my own family choose a bariatric program, I'd absolutely check it, and that is to look beyond the surgeon, look at their bariatric surgery program. This is where a lot of patients make a mistake. They only research the surgeon, but bariatric surgery, it's an entire program. So when you're looking at a bariatric practice, ask, is there a bariatric support team? Is there a clear pre-op education process? Is there long-term follow-up? Do they monitor labs and vitamins after surgery? And if so, how often? Do they explain procedure options, or do they push the same procedure on everyone? Do they have a plan for complications after hours? Do they help manage issues like nutritional deficiencies, inadequate weight loss, or weight regain? Because the surgery itself is only part of a story. A beautiful operation with poor follow-up is not ideal. And a surgeon who is technically good but dismisses your concerns may not be the right fit for you. You want technical skills, yes, but you also want communication, honesty, and a program that doesn't disappear after surgery. And I'll link a PDF with a checkoff list of the items we're discussing today, so don't worry about jotting these steps down. Word of mouth is powerful, and honestly, word of mouth can be one of the best ways to learn about a surgeon. If there's someone you know and trust and they've had weight loss surgery and they're willing to talk about their experience, ask them, but ask specific questions, not just, did you like your surgeon? Ask questions like, did they explain the procedure clearly and did you feel comfortable asking questions? How was the pre-op process? How was the hospital experience? What happened when you had a problem or concern? How was the follow-up after surgery? And most important, would you choose the same surgeon again? That last question is very telling because someone can have a complication and still say, yes, I would choose that surgeon again because they identified it and handled it well. And someone else can have no major complication but say, I felt ignored, rushed, and unsupported after my surgery. So word of mouth can tell you things that a website cannot. Local Facebook groups. Local Facebook groups can also be helpful. If you search for bariatric surgery groups in your city or state, you may find patients talking about surgeons, hospitals, insurance processes, pre-op requirements, and recovery experiences, such as a page like this. But be careful. They are patient experiences and from people that you don't know. They can also be incomplete, emotional, one-sided, or just sometimes untrue. So don't base your entire decision on one angry post or one glowing post. Look for patterns. If multiple people say, the office never calls me back, that matters. If multiple people say the surgeon explains things well and takes complications seriously, that matters. So use Facebook groups as a tool, but not the whole toolbox. Now we're going to talk about something almost everybody does first, and honestly, it's also one of the easiest places to be misled. And I'm talking about Google reviews. Google reviews can also be helpful, but I would use them cautiously. The Federal Trade Commission has specifically addressed fake reviews and testimonials. So fake or manipulated Google reviews are a real concern in the online world. Sometimes staff, friends, or marketing companies may influence reviews. Sometimes negative reviews are actually removed or discouraged. So what do? Look for volume and patterns. A surgeon with just 8 perfect 5-star reviews may not tell you much, but a surgeon or practice with hundreds of reviews may give you a better sense of patterns. And be sure to read the actual comments and give them the same scrutiny as other resources we've discussed in the video. But now we're getting to the part that matters most, because this is where you'll often know whether the surgeon is right for you. The consultation matters most. Now here's the part I really want patients to hear. All the online research in the world cannot replace actually meeting the surgeon. You may find someone with good credentials, an accredited center, positive reviews, strong word of mouth, and then you meet them and something feels off. Or maybe you meet them and immediately feel like this person listens, this person explains, they're honest, they're not rushing me. That matters. When you meet a bariatric surgeon, ask questions. You're not being difficult. You're making an informed decision about a major operation. Here are some questions I would consider asking, and I'm going to include a PDF in the video description below with all questions. Number 1, which procedure do you recommend for me and why? Not just, do I qualify for surgery? Ask why they recommend sleeve, bypass, or another option for you. Number 2, what does your follow-up schedule look like after surgery? You want to know what their follow-up schedule is. Number 3, what is the process to contact a provider if I have a problem after surgery? And I mean a real problem. You want to know how the program handles urgent concerns. Number 4, what are the most common complications you experience and how are they handled? A surgeon doesn't need to scare you, but they should be honest. Complications can happen even with excellent surgeons. So the question is not, do complications ever happen? The question is, will this team recognize them and respond appropriately? Number 5, how many of this specific procedure have you done, especially in the last 12 months? Because for optimal outcomes, experience is important. ASMBS generally recommends at least 100 completed cases per year, with a total case completion of 500 being generally accepted to obtain optimal results. And number 6, what are the options with your practice if I'm unable to reach the recommended amount of weight loss, or if I experience weight regain? You want to see if they offer weight loss medications or can refer you to someone trained in these medicines, or is there an option for surgical revision or even an endoscopic procedure? And I also want to say this clearly. Do not be afraid to consult with more than one surgeon. This does not make you disloyal. It makes you informed. This is not the time to rush things. You are considering a major surgery and you want to do your best to make an informed decision. A good surgeon should not be offended by that. And if someone becomes irritated because you want a second opinion, that may tell you something too. You are allowed to keep your options open. Red flags. Over 20 years, I've noticed certain patterns, and when I see these things, my level of concern starts going up. So if I were helping someone I loved, here are 8 red flags that would make me stop and think. A surgeon or program that guarantees a perfect outcome or a specific amount of weight loss and downplays possible complications. Only performs one procedure and recommends it for everyone. Dismisses your questions or seems annoyed by them. Makes you feel pressured to schedule immediately. Does not discuss long-term follow-up. Does not explain your surgical procedure so you can understand it clearly. Has no clear plan for nutrition, vitamins, labs, or post-operative concerns. And a team that, per reviews or word of mouth, is very responsive before surgery, but hard to reach once you have a problem after surgery. That last one matters. You want to know your bariatric team is there for you, especially after the operation. Now, on the positive side, here are some signs you might be in a good place. They explain your options clearly and talk about risk and benefit. They individualize the procedure recommendation for you. They obtain your full medical history, ask about medications, prior weight loss attempts, eating patterns, and long-term weight loss goals. They have a clear pre-op process and follow-up plan. They involve nutrition and behavioral support. They answer your questions without making you feel foolish. They tell you what to do if something goes wrong. And most important, they don't make you feel pressured, give you FOMO, or make you feel as if you are being sold a procedure. So here's the bottom line. To find a reputable bariatric surgeon, do not rely on just one source. Use multiple tools. We discussed several today. I'll list all the links to those resources for you down in the video description below. None of this guarantees a perfect result, but it can help you make a more informed and confident decision. And remember, the right surgeon for one person may not automatically be the right surgeon for you. So take your time and choose the surgeon and program that make you feel informed, respected, and safely supported. If you found this helpful, subscribe for clear bariatric surgery and medical weight loss education. If you want to see more in-depth videos about bariatric surgeries, click here or here. And as always, this video is for general education and is not personalized medical advice. All healthcare decisions should be made by your healthcare team. Thanks for watching, and I'll see you in the next video.